Hello, this is Dr. Eric Bricker, and thank you for watching A Healthcare Z. Today's topic is the No Surprises Act, Independent Dispute Resolution Impact on Employer-Sponsored Insurance. Woo, that's a doozy of a title. Okay, so as a quick review, the No Surprises Act, oftentimes abbreviated NSA, was originally passed about 4 or 5 years ago, said that there were no out-of-network bills to patients if the patient received care at an in-network facility. So what was happening was that patients were going to in-network hospital, but that in-network hospital had an out-of-network radiology group there, or an out-of-network ER physician group there, out-of-network anesthesiologists, out-of-network pathologists, out-of-network surgical assistants, and then the patients would get these out-of-network bills from these doctors that they never even saw. Like the patient never saw the radiologist, the patient never saw, a lot of times they never saw the pathologist. They get these bills. It's like, why in the world am I getting this out-of-network bill? So the No Surprises Act said, okay, you can't do that anymore. So instead, the insurance carrier and the physician group have to duke it out just between the two of them and leave the patient out of it. Okay, well, guess what happens when they quote unquote duke it out to try to be like, okay, well, what amount are we going to pay here for you? You know, the law didn't force them to be in network, but it said, okay, listen, if the physician group and the insurance company cannot come to an agreement, then they have to go to this independent dispute resolution process, which is arbitration. And the arbitration is set up where each group gives their sort of best offer, and the arbitrator picks one of the two. They don't split the difference. They're like, okay, you know, hospital or the physician group is like, we think we should get paid X, and the insurance company's like, well, we should think that they should be paid Y, and obviously X is much bigger than Y, and then it's up to the arbitrator to decide, are they going to pay X or Y? They're not going to pay some amount in the middle. Okay, so what's the volume on these IDRs? So there's about 300,000 of them a quarter. Okay, so it's not like millions a quarter, but it's not like 10 a quarter. Okay, so it's a pretty significant amount, about 300,000 of these, and it's been increasing. At first it was 200,000, then it was 250,000. Now it's over 300,000. Okay, and guess what? The provider, the physician groups win 80 to 85% of the time. Whew, that sounds like a pretty awesome deal for the physician groups, and that sounds absolutely horrible for the self-funded employers whose insurance carriers are supposed to be acting on their behalf. Sounds like the insurance carriers aren't acting too well on their behalf, or it sounds like something's going on with those arbitrators. Okay, so what the insurance carriers are typically offering is something called QPA. And that QPA is the median in-network rate. And originally, when the law was first passed, the QPA was what the physician groups and the insurance companies, they were going to agree to the QPA. But that's essentially like forcing the providers to accept the in-network rate, because the QPA is just the median in-network reimbursement. So instead, the providers have been asking for and receiving, on average, about 4.5 times the QPA. Now, keep in mind, the median in-network rate for physician reimbursement for commercial insurance plans, like that's already about like 1.5 times Medicare, right? So, and it even changes by specialty. Okay, so for radiologists, they're getting like 6 times the QPA. Which is, and if that's 6 times the QPA, and the QPA is 1.5 times Medicare, then that means that they're getting like 9 times Medicare on the out-of-network radiology reimbursement. For neurosurgery, they're getting 11 times the QPA, which is really close to like 16 times Medicare. Okay, in fact, there's even one example from a self-funded employer I talked to. They had a surgical assistant for one patient, for one operation, where the surgical assistant was paid $200,000 as the arbitrator. That's what they said. The surgical assistant's like, we think we should pay $200,000 for this surgery. And the arbitrator agreed with them, and they got paid $200,000. And this employer actually said that they're running over budget this year, and part of the reason they're running over budget is specifically because of this IDR process for out-of-network providers at in-network facilities. Okay, so interestingly, these IDRs are being levied by only a small number of physician groups, and they even know them by name. It's Radiology Partners and Team Health and SCP. And interestingly, these physician groups are primarily private equity owned, because private equity ownership is very good at making money. They have no interest in lowering healthcare costs in America. This entire IDR process, with the providers winning 4.5 times the QPA 80 to 85% of the time, all it does is increase healthcare costs in America. Okay, so just know at the end of the day, this increased costs in America, and that's exactly what the private equty firms that own these physician groups, that's exactly what they want to do. They have no interest in helping the national problem of high and rising healthcare costs. Like they have no concern. They treat that national concern with impunity. Okay, so fine. So then that begs the question, who are these arbiters? I mean, listen, these private equity firms, listen, they're publicly traded. Like, their only mission in life is to make money. They really don't care about anything else. Okay, so then the arbitrators are letting them do this. That begs the question, who in the world are these arbitrators? Okay, they are outsourced contractors to the federal government. And the win rate for providers is actually highly variable there's about 15 of them, about 15 of these different contractors. For some of these contractors, their win rate is 90% for the providers. For other contractors, it's as low as 33%. Obviously, the majority of them are much closer to the 90%, right? If the average is 80 to 85%, then a lot more of these arbitrators are up at the 90% and they're down at the 33%. So obviously, when the insurance company and the provider are choosing their arbitrator, they're really particular about which arbitrator they use, because they know that certain arbitrators are going to 100%, almost 100%, be favorable to them. So what are some of the names of these arbitrators? Like, you can just go on the internet and you can look them up. So they're like C2C, Edify, FHAS, Island Pro, Maximus. What in the world are these companies? Who's ever heard of these companies before? Some of them are nonprofit, some of them are for-profit. Often, many of them are run by lawyers. There's even companies that will proactively take on the responsibility of filing the IDR. It's like an enterprise. So for like smaller physician groups, one of them's called Halo MD. They're like, you can't do this yourself? Just hire us and we'll do it for you. Okay, so then the question becomes, what can an employer-sponsored health plan do about this? So one is if you're self-funded, you need to go to your carrier and ask them, one, you should be getting your claims, and then two, on your claims, you should be asking them to identify which claims have gone through the IDR process. And there's probably a very high chance that they're going to tell you no, either we can't or we won't. And listen, if you're running an employer-sponsored health plan, you have a fiduciary responsibility to the plan members to be good stewards of the plan. And not knowing which claims are coming through the IDR process is almost de facto not being an adequate fiduciary. Okay, so fine. So you need to know that. Why do you need to know that? So you can go. Oh, by the way, there's very specific, so not only is there a select few physician groups that do it, it's concentrated in certain states. So if you're an employer with employees in Texas, Florida, New Jersey, New York, Arizona, Tennessee, and Georgia, those are the worst places. And I will tell you, in general, for provider fraud, sort of the epicenters of provider fraud in America are Texas, Florida, New Jersey, and New York. Texas, Florida, New Jersey, and New York. Like, those are the hot spots for, listen, a bad apple spoils the bunch. So you just better know that if you've got employees in those plans, there are absolutely physician groups who are 100% trying to twist the arm of every single payer humanly possible to squeeze every last dime out of reimbursement. And everyone's like, oh, these rural hospitals are suffering. Yeah, maybe, but not maybe, definitely, fine, rural hospitals are suffering. But there are absolutely provider groups that are raking it in Texas, Florida, New Jersey, and New York that are not starving for cash at all. Okay, so the provider world is not all starving, right? There's the haves and there's the have-nots. Okay, so rural hospitals might be the have-nots, but there are absolutely provider groups that are the haves. And again, I'm not blaming them for doing this. Like, this is America. If they want to use their free will to make as much money as humanly possible, then they're entitled to do that. But you, as a self-funded employer, are also entitled to stop them from doing that. And there's a couple of things you can do. So one, is you can steer your employees away from these facilities that have these out-of-network providers that are taking all these claims to the IDR process. Like, that's how you're going to be like, listen, hospital system, if you're going to employ a radiology group that is going to shellac my employee health plan, then I'm going to do everything humanly possible to not have my employees go to your hospital system. So it's up to you, the hospital system, to go back to your radiology group and to tell them, look, we're losing business because of your behavior. And until that happens, then like the spigot is open, and you, the employer, are going to continue to be exploited. It's not going to change. Okay, and then next up, you absolutely better talk to your congressman or woman about these arbitrators. Like, why don't we have a congressional panel of these arbitrators? Why don't we have the Department of Justice look into these arbitrators? Why don't we have CMS look into these arbitrators? Maybe what they're doing is completely appropriate. I'm not saying it's not. Maybe an 80 to 85% win rate for providers by the arbitrators, completely appropriate. I have no clue, but it needs to be transparently investigated. And that's all I'm saying. Thank you for watching A Healthcare Z.